I'm so happy that mindfulness has been borrowed from Buddhism and secularized and introduced to our country through stress reduction and through DBT and CBT and EMDR and all of these techniques that all kind of include mindfulness, and almost all of the founders of these psychological healing techniques, somatic experiences, when pressed, would be honest about that they borrowed it from Buddhism. And I think it's just so fantastic because it's such a healing practice and transformative, and that's why the kind of mainstream medicine and psychology is accepting it, because it works. And Steve and I kind of are a little bit traditionalists or whatever, so we like to admit that it's Buddhism and that there's a bigger context that comes along with mindfulness. But personally, I'm very happy that mindfulness is being introduced in this way to this society, and in particular to psychologists who sit with so much suffering all the time. And I don't see how people do it without a meditation practice personally. But actually most people that do it don't have a meditation practice. So they find other ways to cope. But also there's a lot of burnout because of the lack of self-care. And so anyway, some of my thoughts, I hope that was useful and interesting to you. And I think that Steve and I are going to open it up for some dialogue, for some conversations, a little bit about what brings you to this conversation, what interests you, what are you taking away, what are you learning, how will this be helpful in your practice, in your life, in your clinical work. Is there any things that we didn't address that you're curious about? Just some time for Q&A.
The question about the definition of the eight, or just the description of the Eight Noble Truths. You've alluded to it. I've done a little bit of work with it, but it would be helpful for me to just
hear it.
Touch on, maybe touch on what they are.
So I'll start and dance with me. So the Four Noble Truths of the Buddha and the Eightfold Path. The first truth, Noah, I think, alluded to in his talk and or in the meditation, is that life is or contains dukkha, which is translated most often as suffering. And not for nothing, that's often what then sends people running away from Buddhist practice, because it sounds like such a downer. While at the same time, it's kind of like, yeah, life has suffering. So the second truth is that the cause of this suffering is craving, attachment, aversion, the moving in a craving fashion towards pleasure, and the avoiding pain. And again, just coming from the psychological perspective, it's not like that came out of nowhere. It's survival. It's part of what needs to happen for us to survive. But it gets out of hand. So the third truth is that suffering can end. And how would that happen? It would end through the end of craving and attachment. And then the fourth truth is that the prescription is that the way to do that would be the Eightfold Path. And in thinking about this day and the work that will follow within it, it's really like the Eightfold Path is much like in refuge recovery. It's the construct. where it sort of unfolds. And so the first factor is that of wisdom or right understanding. And it's been said by a number of teachers that the reason why that is the first factor is because we need just at least enough understanding or wisdom to think that the rest of the factors might be a good idea to pursue. Right? More than that would be nice, but if we have that much, then we might go to the second factor, which is to set intention, right intention, which is what we focused on together during meditation. And so the idea there being that, when I don't have right understanding, if I have wrong understanding or lack of wisdom, when I set intention, it's going to be set from an unwise place, an unwholesome place. I can't remember which Jack Kornfield book I was reading recently, but he in one passage talks about the translation of wholesome and unwholesome is actually, the translation is unwholesome and beautiful. So unwholesome acts or unwholesome intention and beautiful acts or intention. I don't know if that's poetic riffing on his take, or
Most likely.
Most likely, he do like the poetry. So, as do I. So, in any case, so that intention being set out of the right understanding is wonderful, right? Thought precedes action, intention precedes action, and so the next three factors. So those are the wisdom factors, and then the next three factors are the ethical factors. And so that's where the rubber meets the road in the world. So right speech or wise speech, wise action, and wise or right livelihood, which I spend a lot of time enjoying that's one of the 8 factors. Just, I don't know. The others seem sort of the small elements of how the mind works. And then it's like, what are you doing at work? And it also applies very heavily when it has to do with what we're dealing with here in this retreat and the work that we're doing. So those are the ethical factors. And my New York translation of those, I'm from New York originally, so my New York translation is don't say dumb shit, don't do dumb shit, and don't be mean and hurt people at work. And then there's the mindfulness factors or the meditative factors, and that's the other thing that really continues to draw me to the Dharma. And when I'm teaching this with either newly sober addicts, and I also do mindfulness groups with people with other mental health diagnoses, and they might not have any addiction diagnosis. In any case, when I'm introducing the path to them, and often in those groups, it's like very first meeting with this. Perhaps they've been in another place where they did get some more secular mindfulness, but I'm teaching it, through the factors and the rest of it. And so the 3 meditative factors are effort, mindfulness, and concentration. And so the effort is specifically to do with the meditation and the mindfulness and concentration. Concentration practice allows us to attain a more concentrated mind, a more directed mind, a more calmed mind, and then that results in, and it's a dance. It's not this and then that, but in a wider scope and a bigger frame of mindfulness of the moment. The non-judgmental awareness of that which is in the moment. And so when I'm describing it to people, it's like, wow, this path is 3/8 meditation. That's a large portion. So look at other traditions or other psychologies. I think mathematically speaking, they might not measure up in that same way. And it's also when I become mindful of that, that it's 3/8 of it is right there in the practice.
I might even say that it's 100% mindfulness, because you can't really have understanding without mindfulness. You can't really direct your intentions without mindfulness. You have to be mindful of your speech. You have to be mindful of your actions. You have to be mindful of your livelihood and your relationship to money and sexuality. That actually the whole path, mindfulness comes as number 7. And this is why I don't really have a problem with secularizing it and not having the other 8 folds. Because if people are really mindful, they're going to start paying attention to what they say and what they do and their relationship to work and money, and they're going to develop some understanding. And that's been true for actually most of the meditators in our culture, where they weren't really studying the Dharma, or they weren't really focusing on being ethical, but they started sitting. And through sitting, and just like the Buddha, he didn't have the Eightfold Path. This is what came out of his mindfulness. He was mindful, and this was what he was mindful of. Oh, how I act and how I speak and what's arising in my mind. And so, yes, it's 3/8 and it's 100%. It's 100% of the practice. And even compassion stuff that I was throwing in there is also mindfulness. When you're paying attention to your relationship to pain, and you see how much you hate it, and how much suffering there is around that aversion, then compassion becomes the only rational relationship. We have this irrational, I hate pain, I want to get rid of it, and then I'm in stress and fear and suffering all of the time because I'm trying to get rid of inevitable, unavoidable unpleasantness. And so then compassion also comes out of mindfulness, I think. That's what I think.
One of the wonderful things about being a human being in the 21st century and the 20th century to boot is what's happening. And I actually enjoy watching the dialogue that sometimes actually turns almost nasty between, the smackdown between the Dharma folk and the secular mindful. It's like, really? That's going to be a fist fight? But who's going to win? But the point being that it's wow, that's what's happening. And that as a result, that dialogue goes into the mainstream, and then more people are talking about it, more people are practicing it, and more people are becoming more mindful, and more people are able to point their attention towards these other factors.
The elders always win.
There's a Monty Python image going through my head. The soccer game between the philosophers.
There's a question in the back.
Yeah, I want to thank you guys for having us. Steve, I'm Adam. We actually spoke.
Yeah, hi
I'm
Adam.
enrolled in a master program because I heard Steve on the radio and talked to him about getting at a world university. And I've gone through the mental health system myself and therapy, and gone through my own stuff. My brother and sister are both in recovery. And going through this program's great because it merges a lot of the East-West modalities. And I've with a lot of other therapists who are Western approach therapists, and I think Buddhist psychology should be implemented in all psychology programs because, we have higher rates of depression, we have more medication, so we're treating symptoms, but we're not getting to the root issue all of the time.
Yeah.
And I work in juvenile halls and with foster youth and kids with a lot of trauma, and I found, Jack Kornfield's teaching and different people's teaching a very simple and easy way to translate these things, and they really understand them as well. So I think, too, when you're young, we're sold this good that we're going to be happy and we're not going to have suffering in our life, and when it happens, we're kind of hit by a freight train. So I think if we're told about that to understand as a young person and know that these things will happen, I think we'll be able to kind of build that armor for our future. So I think it's really great to have this implemented in all types of social work and psychology.
Normalize it. Yeah, it's a very different worldview than the Judeo-Christian theistic or even science, kind of atheist science view that kind of can push that you should be happy, and if you're not, you're doing something wrong. Where Buddhism is really normalizing, like, actually, happiness is really fucking hard work. It's not going to happen just because you went through puberty. Actually, that's gonna, it's gonna all be really difficult. And with the right kind of attention, and you can actually, have it. But there's gonna be the pain and the sorrow is inevitable.
And I think what you said about the elders too, we've lost that
Yeah.
relationship.
Yeah.
And we see it in our youth. They're lost. They don't know where to go. And I think we need to bring that back. Obviously, those ancient traditions had something right. So
It's Justin Bieber's fault.
I thought you were a believer.
I'm a believer.
You had asked why we're here, why I'm here. I can relate to much of this. I grew up in Brooklyn, or at least spent the first 17 years of my life, and I've spiraled around meditation for decades and decades, very sporadically. But I mean, my mother got me into TM when I was 15 to calm me down and blah blah. But I went back to school and I became a psychologist. And one of my students, one of my fellow students had taken robes in Sri Lanka, so I learned about Vipassana then. And it's all story, but basically I find I'm highly skilled at supporting my clients, patients, whatever we're calling them, in easing their suffering, and I seem to be very unskilled in easing my own, which is a part of why I'm looking toward more community, more sangha, more of that, because again, my tool for not burning out is probably to have a great capacity to compartmentalize and not take it home, but that's not in full integrity either. So that's really the work, and I'm experiencing a lot of that. I'm in George's class now too, so the meditation and the attachment theory and the psychology, they're all marrying each other in such a wonderful way. So I'm really grateful that there's something else being created on that, and so I wanted to thank you. But that's why I'm here.
Thank you, Adam.
Yeah, so I'm going to try to make this into a question, but I'm struggling with that in my mind. I have some clients who are really, really suffering in a deep way and are very stuck in that suffering and the stories around that suffering and their traumatic history. And I find that I, in turn, am really struggling or experiencing aversion towards that stuckness. Mm-hmm. And I turn it into the story that I turn it into is, oh, I'm not skilled enough. I'm not being useful. I'm failing my clients. And what you said was really helpful about not taking it personally. And also the compassion meditation really helped. But I'm wondering how you, in the face of this suffering and stuckness, how do you not take it so personally other than through compassion and equanimity? And maybe those are the answers, I don't know.
I mean, of course, those are the answers. Compassion and equanimity are the answers. But also, I feel like for myself, I don't expect everyone that I see to get better. I don't expect every single person to get it. And maybe, I don't know, maybe I should have a higher, but I feel like I have a sense that everybody's not going to get it. But I'm still going to try to help everyone that I come into contact with, especially if they seek me out, if whatever it is, I'm going to try. But I'm not going to suffer a lot if they don't follow through, because in my experience over the last 20 years is that it's actually more common for people to not heal than to heal. It's more common for people to stay stuck, to relapse, to whatever, to stay stuck in the story. And if there's 20 or 30% of them that really get it, those are the ones that kind of you celebrate and you support and you and so Buddhism would have this kind of bigger view around karma and readiness and even the traditional equanimity practice, which has helped me a lot when I get attached to someone being non-attached, right? You see how attached someone is and how much they're suffering about their attachment, and then you notice, oh, and I'm really attached to you fucking letting go of your story, and I'm suffering with you. That's compassion, right? I'm suffering with you. No, that's not compassion. But sometimes we do that, right? We fall into that. So one of the equanimity phrases that we train our mind with in Buddhism, and you already know this maybe, is everyone has their own karma. Their happiness or their unhappiness is going to depend upon their actions, not my wishes for them. Now, compassion says, I wish for everyone to be free from suffering. That's a sincere wish. But I balance that with, I understand that my wish isn't going to take away your identification with the story, your trauma, your willingness to do what needs to be done. I'm still going to show up and give you all of the tools and tolerate you for as long as I can, and all of that. I'm going to show up in the best way possible, but not take it so personal of like, if you don't get it, it's my failure. And it's a tricky line, right? Because sometimes it's like, well, am I doing everything that I can? Am I showing up in the right way? Have I given a second and third chance or whatever it is? I mean, running a treatment center, that's always an interesting thing of, like people relapse. Do you kick drug addicts out for doing drugs? Right? And how many times do you let them come back? Right? Like, oh, you've been here 4 times already. It's not a failure of our treatment because our treatment's perfect. We gave you the Eightfold Path. What else do you need? But so, whatever that, right? But how many times, right? And when does it become enabling? And when does it become time to say, you've tried this 4 times, and let me refer you somewhere else. Let me get, maybe there's another person that will be able to support you. And then maybe there's some heartbreaking acceptance that some people are not going to get it in this lifetime. Whatever it is, aren't going to get it in this lifetime. Whether that's recovery or whether that's balance or whether they're not going to get it in this lifetime. And that maybe that's actually more common. Maybe most people. The Buddha said only a handful of people will come to enlightenment in each generation. Whatever a handful means. I riffed at one point of saying, well, maybe that one means 1%. 1% of, is there like 8-something billion humans now? That'd be a lot. Was that 80 million? Is that right?
That's
80
enough.
million people are going to get enlightened in this generation. But the other 7.9 billion are not.
Oh, I was just going to add to what you're saying, that a lot of times I find that my attachment is really to time. When I'm feeling that sense of like failure in the moment of this person's not, getting what I'm trying to help them about. And it really, because I know for myself how I went through my stages of development, something was said to me, and it was, I'm not totally conscious of how it's working in my spirit, and my soul, and my mind. And all those things add up over time to then somebody coming to a realization about themselves. And so I don't look at it as, I do my best to not look at it as a failure or to, that I can't help this person. It's that I'm not in control of their recovery, their healing. It's not on my timeline.
Yeah.
I'm, through meditation, I'm able to disconnect kind of my mind from words that are coming out so that I don't feel as much attachment to it. Yeah. And really just trust that intuitively, like I'm sharing from a larger consciousness through me. And once I think about that, it's just so helpful. And that's really karma too. I mean, just at the time,
Yeah.
One of the manifestations of my work life was doing prevention and intervention education with young people in schools. And there was an image that was given to us to use with young people about informal intervention. And so we said, and it fits, perfectly, is, they said, imagine you're born, and when you're born you have this backpack on, and young people love the image of like this naked little baby with a backpack, And so you're getting older, and let's say you're 14, you start using. Or you're 12 and you start using, and the first person who ever comes up to you and says, I'm really worried about you. And, you give the answer that you give at the age of 12, either I don't know what you're talking about, or screw you, or whatever, but they have placed a brick in your backpack. And so you go, and then you're at college, you're 16, 17, and someone says, oh man, I'm really worried about you. Yeah, I'll be fine. You're using just as much as me, or, however that goes. Another brick is in the backpack. So the years go on, and then the person's walking around like the hunchback from Notre Dame, and has like this huge thing of bricks, and the last person in that particular chain, not knowing about all the others, says, I'm really worried about you, and the person's like, here, I got to take this off. Puts the brick in, and you're like, that's heavy, and they're down. So the point being that if not every one of those other bricks were put in there, would that last brick have the, right? So thereby what we've been saying, which is I'm compelled to put my brick in, and I have no idea which brick it is, but we're laying bricks. And I didn't just say that. Yeah. So anyway, like laying bricks. All right. So in any case, so yes. And as it relates to karma, and as it relates to, there's a Zen saying that even if you brush sleeves with someone, you will meet them again karmically in another lifetime. Sometimes those other lifetimes are within this lifetime. So just mindful of, I don't know what impact I'm having on someone, right? Whether it's in the office or whether it's just the interaction at the grocery store with the person behind the counter.
Can I just say one last thing that I just
Sure,
thought?
and then
When
Berkeley.
I work with a lot of parents and that are wanting to put their adult child or adolescent into some kind of treatment. And I always remind, and I'm reminding myself when I say it, is that this exact concept of your child may not show you their gratitude right now of me doing this, but believe me, like, they will remember if you didn't do it. And two, they will know that they are truly loved, I mean, in a way that, because I work with a lot of parents that are just like identified patient, don't want to deal with it, and the parents that are like, oh my gosh, I want to go to Al, I'm just like, please come, let me just, I love these parents because that wasn't my experience, and so I know like how it shapes you, and like how I just want the parents to be able to acknowledge themselves in that moment when their kid is kicking and screaming, or even just if their kid is ready for treatment, but they're just so depressed, to know that you are part of the solution right now. And I always have to remind myself of that too. We're part of the solution.
We have time for maybe one or two more questions, I think. I saw Berkeley. Yeah.
Just to piggyback on what Amy and both you were saying, and adding my own little tweak through my own experience. I suffered through this thing of addiction for 28 years. And the way that I see myself today, and I shared this with you, I think, Stephen, when we first met, but see myself as a farmer. On some days, I'm planting seeds of hope. On some days, I'm watering those seeds. And on other days, I'm harvesting those seeds. So as we are passing a life through each one of our hands, we're playing or playing a different position, if you will. But for me, it's never giving up. Never giving up hope, but knowing and sending with that individual, if I'm seeding that particular moment, I'm also encouraging with my life energy.
Thank you.
Hi, I'm an anthropologist, so my work is more with collective recovery from historical trauma. And I'd be interested if you might speak to either an example of how this Dharmic wisdom might be used in facilitation with community or organizational work. And also I'm from Queens.
What neighborhood?
Bayside.
Bayside. So, going back to just my own experience, which was, Crown Heights riots happened. I got trained by, all these nonprofits came running into the neighborhood, thank goodness.
Yeah.
I got trained in all kinds of modalities of how to facilitate conversation, how to facilitate change in communities, how to reduce or end prejudice, stereotyping, discrimination, facilitating dialogue or facilitating conversations with people and communities in all the manifestations of ism and the rest of it. And so, similar to my therapy practice and my high school teaching practice, that was fed intensely by the Dharma. So some of it I almost find hard to explain, in as much as the same way I find it hard to understand how people are able to do their clinical work without the mindfulness practice. But what I've found in terms of historical trauma and communities' historical trauma is that it's not that much different than the personal trauma. In other words, it's another manifestation of suffering, and part of the dilemma is that it is an often either misunderstood or put in the denial box manifestation of trauma. In other words, I, as the person without that trauma, denies that your trauma is real. So for me, the Dharmic wisdom is that if I am in a place of mindfulness of the reality of oppression, or the reality of privilege, or the reality of how suffering can be produced institutionally and propagated and expanded and exacerbated, then I can, from that wisdom, set an intention as to how my speech, my action, and my livelihood is going to manifest change where change needs to happen, or manifest healing where healing needs to happen. So that's the short version.
Yeah, it's complicated.
It's very complicated, and to be honest, I'm glad that you brought it up. I'm glad that each of the questions come up and I'm glad that Noah invited the beginning of the dialogue, because again, this is going to be an ongoing series of retreats and dialogues and classes, and that is some of the subject matter.
Oh, good. Thank you.
Thank you.
I didn't have a mic to drop, so I had to drop something.
Wow, that's Dharma. Drop the bell ringer. Whee!
I think we're done.
Yeah. So, in closing,
My contract said 1 p.m.
and being that he signed the contract, not knowing that it was completely free of charge. So, I want to thank everyone for being here.